name is Judy Lagasse. I'm a registered nurse, board certified in wound care. I will be talking to you today about preventing pressure ulcers, therefore maintaining your skin integrity. I'm going to begin with the skin is an organ. The skin is the largest organ of the body. And like any other organ, the heart, kidneys, lung, it requires the flow of blood to carry the oxygen and nutrients in order to keep the skin alive. Because it's exposed to environment, it's often abused. We have 3 layers of skin: the epidermis, dermis, and subcutaneous layer. They regenerate every 2 months, beginning at the bottom layer and working to the top, and then when it's at the epidermis layer, which is the skin that you see, it sloughs off. That's why you see flaky, dry skin at times. It's the dead cells being sloughed. Because it takes 2 months to regenerate skin, and that's approximately 2 months, if you have a pressure ulcer that is through all 3 layers of skin, it's going to take a minimum of 2 months and maybe longer in order to heal the pressure ulcer. The skin has many functions. One is to protect against the loss of body fluids and electrolytes. It's keeping what's inside in and the outside out. It also protects against bacteria. We have a normal amount of bacteria on our skin that is there to protect us, and it protects us against foreign bacteria. It regulates the body temperature. If we get too warm, the vessels dilate and we begin to sweat to cool our bodies down. The reverse is true. If we're cold, the vessels constrict and therefore we shiver and we try to conserve energy. The other function is to metabolize vitamin D, as you know, is very important in order to absorb calcium and to maintain our bones. To maintain skin integrity, we want to avoid harsh soaps. If you're using a bar of soap, you want to make sure it says has cream, lotion, or a moisturizer within the soap. Liquid soap body washes are better than actual bars of soap. It's important to moisturize your skin after bathing. The best time for lotions and creams to absorb into the skin is when it's slightly moist, so after bathing would be a good time to use the moisturizers. Adequate fluid is always important. If your body is dry on the inside, it'll be dry on the outside. So therefore, it's important to drink. At least every 2 hours, take a drink. And maintain your diet. Without protein and adequate vitamins and nutrients, your skin will die. Loss of weight causes loss of body fat, the fatty layers of the skin, and therefore the bones are not protected against the organs. So what is a pressure ulcer? A pressure ulcer is a localized area of tissue damaged by being pinched between the bone and an outside surface, a bed, a wheelchair, a brace, therefore reducing the blood supply to that area. Now, if a blood supply is cut off to an area like a heart, you will have angina, or you could even have a heart attack and die because of lack of blood. The same thing happens to the skin. If it does not receive enough blood, the skin will actually die. The location is so important because the pressure ulcers occur again with the skin being pinched between the bed or an outside surface and the bone. So it's the bony area that's going to be subject to breaking down. If the person is laying on the back, if you're in bed a lot, you can't get out of bed, you're dependent on somebody getting you out of bed, your bottom, your tailbone, your heels will most likely be the areas that will break down, especially if you have poor circulation or diabetes and you may have a lack of sensation or perhaps you've had a stroke. Your heels are very vulnerable to breaking down because you can't feel the pain. If you're in a chair, if you're sitting in a wheelchair most of the day, if you're sitting at the kitchen table or in a recliner, perhaps you can't sleep in a bed because of respiratory problems, COPD, then you might break down on the ischial area, which is the bone that you can feel if you feel your buttock area. If you're laying on your side, your elbows, knees, and ankle bones, mainly because these are so bony and there's not much fat covering that bone to begin with, so it doesn't take much of a sore to go deep into or toward the bone. So the top 4 areas that you want to be careful of are your sacrum or your tailbone, the ischial areas, the bone that you feel in your buttock area, your heels, your hips, and your ankles. So if you have a caretaker and you do have limited mobility, you want to make sure that they check these areas every day for any discolored areas. This is an example of a pressure ulcer. It's on broken skin. The skin is intact, but you see that it's a round red area. If you push on that area with your finger and it turns white, then it's not a pressure ulcer, but a pressure point, which means that if you're not careful and reposition yourself, then that can develop into a pressure ulcer. When you push on it and it stays red, and it does not disappear after you change your position after 30 minutes, then it's considered a stage 1 pressure ulcer. Another example is the heel. This is what a stage 1. It's pink, it's intact, it's not opened at all, but it does not turn white when you push against it. And here's another one on the hip. Now this can occur too from briefs. If the brief has been put on too tight, it has tabs, or the tabs get onto the skin, it may cause a pressure ulcer from the tabs of the brief. Again, pushing on this, if it turns white, just stay off it, and 30 minutes later it'll disappear. Otherwise, if it stays pink, it is a stage 1, and you do need to have some medical advice. So again, you'd want someone to call the doctor. You may need to have a visiting nurse come in and evaluate that and take care of it. What to do while you're waiting? You call the doctors and it's a while before you hear back or before you can get in to see him or her. So you want to keep off that red area. Keep changing position. If it's on a heel and you're in bed or on a chair, put a pillow under your heel to keep it floating. If it's on a side or your tailbone, then you'd want to change your positions at least every 2 hours to prevent new areas from developing. You want to increase your protein in your diet because, again, you don't want to lose weight. It's important to maintain your weight and to even improve it. You need protein to heal the skin. And what is most important is do not rub the reddened area. It's already damaged, and by rubbing it, you're going to cause more damage. This is a stage 2. Now the skin is open. Doesn't look like much. It's not very deep, but it is open. You may have some drainage coming out. It may be moist because our body is a bag of fluid. So now we have an opening where the fluid is going to leak out. This needs to be covered. It needs to have a moist dressing. You don't want to leave it open to the air. You don't want to put a dry dressing on it. You could put some Vaseline on it. You can put a topical antibiotic ointment on it, something to keep it moist while you're waiting for the doctor. Who is at risk for pressure ulcers? The elderly, mainly because our skin ages with us. After the age of 60, our skin is becoming thinner and more fragile. Our blood circulation is decreasing, and so therefore it's going to be subject to tearing very easily, skin tears on the arms. Perhaps you're on some medication that causes bleeding. If you bump your arm and bruise it, you'll see purple spots under the skin. If you do get a skin tear on your arm, you want to cover it, but be very careful of Band-Aids and adhesive tape. it's better to use a roll dressing or an elastic dressing that won't tear the surrounding skin. People who are immobile, they're wheelchair bound, they get up in the morning, maybe somebody comes in and gets them out of bed, and they're dependent until somebody comes back at nighttime to put them back. These people are going to be very at high risk for breakdown. Maybe somebody again sleeping in a chair because they can't sleep in a bed. So anybody who is not able to move and change their position. If you are wheelchair bound, if you are in a chair most of the day, you want to try to lean to the side, lean back and forth. If you can stand up for just a few minutes and then sit back down, that will help with the circulation. People with poor appetite, weight loss, usually will break down because the skin is not getting the nutrients that it needs. So maintaining your appetite, your weight, small amounts of food, eating high protein, the Ensure, Boost, Carnation, any of those that are high protein are good as a supplement if you can continue eating. People who are incontinent may break down because wet skin is not strong. It is subject to shearing and friction if you're sliding at all in the bed or in the chair, or sliding when you're changing your position. So you want to address incontinence and make sure you're having good care, washing yourself and changing your briefs as often as possible. You want to seek medical advice. Without medical supervision, the pressure ulcer will continue to go deeper, increasing the chance of infection. You may become septic. This will require more oxygen, more nutrients. It will increase the flow of blood to your skin, therefore decreasing the flow to the other organs. It may lead to multi-organ system failure, and it may even cause death. So it is important that you do call your physician and have a professional medical person involved with your care. Signs of infection: the surrounding skin is pink. I'm just going back to stage 2. The picture on the left, the surrounding skin is pink, which is a sign of infection. The wound itself being red is good. We want the wound bed to be red, but not the skin around it. There may or may not be an odor. The drainage, if it looks like water, is not to be concerned about, but if it's pus, then it's definitely a sign of infection. And there again, you need to contact the physician and be seen. You probably will need some kind of oral antibiotics. To help prevent infections before and after care, the best thing to do is wash your hands, singing happy birthday twice, and most of all, again, call your physician if you suspect an infection, as well as any changes in your skin that you're not sure of. Thank you.